It's that time of year when teachers are starting to think about professional development and continuing education courses for the summer. I am so excited to announce that the Savvy Dance Teacher Applied Dance Science Teacher Training course is back again for another year. It's happening September 1st and 2nd in the Vancouver area, and registration is now open. For those of you who may not know, the Savvy Dance Teacher is a 2-day in-person practical course that covers the latest in applied dance science topics. If you're looking to incorporate more injury prevention, functional anatomy, active mobility, strength and conditioning, and lots of other stuff into your teaching, this is the course for you. For more information, check out www.allegroperformance.com/thesavvydanceteacher. And if you use the code SAVVYEB before July 1st, you can save $100 off your registration. And now, here's today's episode.
Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Today, we are going to be talking about Sever's disease, or sometimes called Sever's disease, and what that means for dancers. So first of all, I just want to say that I have no idea if it's Sever's or Sever's. You hear both ways. I will maybe even use them interchangeably throughout this podcast episode, but just so you know, they are the same thing. It just gets pronounced differently. It's a bit of, a tomato-tomato situation. Second of all, I just want to say before we dive into this is one of those conditions that I really wish had a different name. And I think I said the same thing on the podcast episode about Osgood-Schlatters disease, because these are not actually diseases. So Sever's falls into that same classification or same category as Osgood-Schlatters, as you'll hear in a second. And so I would much rather be this termed a condition or a presentation or something like that, as opposed to a disease, because again, that as soon as we put the word disease onto something, it sounds really sinister. It sounds like something that is very, very serious that we need to be afraid of. And this is what I would term more a condition than anything. They got their names way back when and were named after the people who kind of discovered them, quote unquote. So these are the names, and they've sort of stuck in the medical world. But I just want to throw that out there again, because if you or one of your dancers has ever been diagnosed with Sever's disease, it probably sounds a little bit scary. And hopefully this episode today will help to dissipate or sort of reduce a little bit of that scariness so that you can understand the condition a little bit better. So if it is not a disease, what is it? Well, like I said, it's a condition, and it is actually classified as a calcaneal apophysitis. Big complicated words. Calcaneal, or your calcaneus, is your heel bone. So the bone that is part of the ankle joint, but it is the heel bone part of that. And an apophysitis is inflammation of the growth plate. And so in this case, it's inflammation of the growth plate of the calcaneus. So calcaneal apophysitis. I have done a podcast episode specifically on growth plate injuries. That is episode number 28. It's just titled Growth Plate Injuries in Dancers. So it's a more of a general episode talking just about growth plate injuries overall. If you want to learn a bit more about what an apophysitis actually is, or those types of growth plate injuries, go back, listen to that podcast episode if you have not already. I will link it in the show notes. And then I just mentioned when I was talking about the sort of naming of this Osgood-Schlatter as well. And so that is also an apophysitis, and that is specifically of a growth plate in the tibia or the tibial tubercle. So it is a condition that affects the knee. So if you're more interested in that episode, that is episode 129. I will link that in the show notes as well. So these are all kind of talking about the same thing. And if you've listened to the episode on Osgood-Schlatter, some of this information will be very, very similar because, again, it's that same classification of inflammation of the growth plate, but a little bit different presentation, things we do to manage them, stuff like that is a little bit different because it's a different part of the body. All right. So what is the cause of this, or when do we see this happen? Two main sort of causes. Number one, growth. And often rapid or sort of growth spurts is when we'll see this come about. But because this is a condition of the growth plate, it occurs when we have kids and adolescents who are growing. So most commonly, we see Severs or Severs present in sort of the 8 to 12-year-old population, sometimes as old as, say, 15-year-olds, again, depending a little bit on sex. So male versus female, male's going to be a little bit later, potentially, female's potentially a little bit earlier. So, again, it's going to be during those periods of rapid growth. And one of the reasons for that is that bones tend to grow faster than muscles or tendons do. And so if we have a bone that's growing sort of rapidly and that growth plate is really active, and then we have, in the case of Severs, we have the Achilles tendon that comes down and attaches right into that same spot on the back of your heel bone on the posterior part of the calcaneus. If the bone is growing faster and the muscles are not necessarily keeping up, or the muscles or the tendons, we have increased tension that develops in that area, and that tends to sort of like pull on the growth plate or creates, like sort of irritation or pulling or traction through that growth plate. And that is what creates this inflammatory response. So sometimes these conditions are actually called traction apophysitis. I don't know what the plural of that is. Anyway, sometimes you'll hear it termed that as well. And that is because of that sort of pulling or traction that is created at the attachment sites when we have this kind of mismatch in growth. And again, it happens most commonly when our dancers are going through like kind of rapid growth. In general, and this is not always the case, but I would say in general, we tend to see Severs presenting slightly younger than Osgood-Schlatter. So all to do with the same kind of inflammation at a growth plate, but the one in the heel tends to present at a slightly younger ages. So again, that sort of 8 to 12 years old is like really, really common in terms of presentation in dancers, whereas Osgood-Schlatter is maybe a little bit older. We might see it more like kind of like 10 to 13-year-olds. So similar process, different growth plates. We grow at different rates, and growth plates are active in different parts of the body at different times. That's the difference in the presentation. So number one cause is growth, and really more often fairly rapid growth, although not always. Anytime the growth plate is active, this can happen, but we tend to see it more in kids who are having more sort of rapid growth. And then number two, the repetitive nature of some of the activities that we do in dance definitely leaves dancers a little bit more susceptible to this than in certain other sports. So in particular, it's repetitive jumping, and specifically like landing from jumping, that creates, again, that tension or traction of where the Achilles transmits force to the heel. And then dancers who are doing a lot of work on demi-point or on point, again, we're using our calf muscle a ton in dance anytime we're on demi-point, anytime we're going on point. And so when that muscle contracts, it creates that tension that pulls on that growth plate. We also can see it happening with repetitive, what I call like percussive movements of the foot. And so this would be more like repetitively, what's the best way of describing it? It's not really striking the ground. Well, kind of. So things like Irish dance or tap dancing or things like that, where there's a lot of, sort of forceful movement into the ground. that can cause this as well. But it's that repetitive nature of movements that are repeatedly pulling on that growth plate at the calcaneus, or so in the back of the heel. In terms of presentation, how does this present? What are the symptoms that dancers are going to report? Primary symptom is that they're going to report pain in the back of the heel. Super important that we can differentiate this from other types of pain that we get in the back of the ankle or the back of the heel. And so very commonly, I would say, we see this misdiagnosed as an Achilles tendonitis or an Achilles tendinopathy and vice versa. And we also will see misdiagnosis with a posterior ankle impingement as well. So there are ways of being able to determine what we are actually dealing with, but it is not uncommon. In fact, it is quite common that I have dancers who come in and say, oh, I have Achilles tendonitis. That may not actually be the correct terminology, and I have done an entire podcast episode on Achilles tendinopathy, and I will link that one in the show notes as well. But they will come in reporting, and whether that's a self-diagnosis or whether that's a dance teacher who's told them that that's probably what's going on, or whether that is a doctor or some other medical professional who's told them. But a lot of times dancers will come in saying, oh, I have an Achilles tendon problem. And when we actually assess it, it is much more likely that what they're dealing with is this apophysitis or this inflamed growth plate as opposed to it being a tendon issue. And this is important to know because how we treat these is slightly different. So some of the things that we do are going to look similar depending on whether it is a tendon issue or if it is a growth plate issue, but some of what we do in terms of management is actually different. So it is really important that we get an accurate diagnosis. And like I said, we commonly see those three differential diagnoses be kind of mixed up or complicated with each other. So number one symptom is going to be that pain on the back of the heel. And generally it's going to be during dance or immediately following dance, but it's usually associated with activity of some sort. With Severs, usually they're going to have less pain in the morning when they first wake up. So when they've rested, slept, it's going to be less painful. And then as they do more activity during the day, and especially as they dance and do more repetitive, if it's jumping or what have you, like running, those types of activities, their pain is going to increase. And so this is different than potentially a tendinopathy presentation, where oftentimes a tendon is going to be a little bit stiff and grumpy and sore in the morning when you first get going, and then it warms up and it loosens up and it actually feels better, and then it'll get worse again if you overload it. But that presentation is a little teeny bit different in terms of how it responds to rest and how it responds to activity. Generally, we're going to have increased pain, like I said, with like after activities like jumping, running, dancing in bare feet can sometimes be really irritating, doing point work if it's a dancer who dances on point, those types of things. One of the hallmark things with Severs that we do not see with Achilles issues to the same degree, or one of the things we can use as a differential when we're actually assessing this, is in Severs, they're going to be very tender right on the growth plate. And so if you press directly on that growth plate, or there's a test that we do sometimes called the squeeze test, where you're actually squeezing the sides like of the heel bone, kind of, if that makes sense. So it's like squeezing either side of the growth plate, essentially. That is going to reproduce their pain. That is going to be painful. Whereas in an Achilles tendon issue, if it's a tendinopathy, that area is generally not sore, but the tendon itself, if you kind of palpate or squeeze on the actual tendon, that may reproduce symptoms. So the location is slightly different. Now, we can have people who have what's called an insertional tendinopathy in their Achilles, which could be a little bit complicating. However, if we have a dancer who is in the age group of having open growth plates and like going through growth, we are always going to assume that it is Severs as opposed to an insertional tendinopathy. But if we're dealing with adult dance populations and it's tender, like right on the bone at that attachment site, it could be an insertional tendinopathy. But that squeeze test is one of the hallmark signs that maybe points us towards, okay, this could be inflammation in the growth plate itself. We will sometimes see swelling or inflammation or redness right around that growth plate as well. So right on the back of the heel in through there. And again, with an Achilles tendinopathy, we wouldn't expect to see that. And if we see any sort of signs of inflammation or things like that, it's generally going to be in the tendon itself and not at the growth plate location. So those are just a few of the things that we will pay attention to make sure that we are diagnosing this correctly and not getting it mixed up with an Achilles issue, or like I said, even like a posterior impingement, which that gets misdiagnosed as Achilles problems all the time as well. In terms of treatment, what do we do for our dancers who are dealing with Severs? Well, number one is load management. And similar to Osgood-Schlatter, the sort of type of load management that we want to do is we want to unload these dancers to symptom tolerance, basically. And so this is a question of finding the amount of activity that they can tolerate that's not making their condition worse. So we don't necessarily need to completely unload dancers in these instances, although if it is inflamed enough, we may need to look at periods of completely unloading. So that means stopping dance completely for a period of time. Again, this is very different than a tendon, because tendons, we definitely want to address load management, but we don't want to unload tendons for the most part. They respond to loading. They don't respond to unloading. Whereas this being an inflammatory issue, it will respond better to unloading. And so that is one of the things we're looking at is load management, but it is generally symptom limited. So we don't always have to fully unload these dancers. And I would say in most cases, we don't need to fully unload them, but we are going to go based off of their symptoms. When we're looking at load management, the first things that we're going to look at reducing or taking away are those higher impact repetitive activities. So the jumping, the point work, potentially dancing in bare feet if that's irritating, like those types of things are the things we're going to look at first. If we are modifying those activities and they're still having symptoms, we may need to unload even further than that. But in most cases, that's often enough that we can just kind of modify and unload some of those more repetitive activities, and that is enough to manage some of the symptoms. Number two, in terms of treatment, we want to address the calf muscle and Achilles tendon complex. Almost always, we're going to find that there's some tightness or restriction within that area. And any tightness or restriction is going to create more tension or more of that kind of traction or pulling on that growth plate. So we always want to make sure we are addressing calf muscle length and Achilles kind of tension in through there. This can be a little bit tricky because oftentimes a lot of the stretches that we would do for the calf muscles, if we think of our standard, standing runner stretch, or even like a heel drop off the edge of a step, or any of those stretches we like to do for our calf muscle, those can sometimes make this issue worse because they are creating tension or traction through that Achilles into the growth plate. So we have to be really careful about what types of stretches we do to make sure that they are not making the issue worse. We will often do a lot of soft tissue techniques, so whether that's like massage or using like rollers or balls or things like that to work on myofascial release and soft tissue release, because that can help to relieve some of that tension without creating as much traction. And then when we want to start to introduce stretching and more mobility, like I said, we just need to be careful about how we're doing it or which stretches we are choosing to do that hopefully are the least irritating for that growth plate and providing traction through that growth plate. Next, we're always going to look at the functioning of the intrinsic muscles of the feet. So the intrinsic muscles are the small, like local muscles in the feet, and they are the ones that are really, really important for supporting the arches of our feet and helping absorb impact and sort of force mitigation. And if those muscles are not functioning optimally, then oftentimes we will see increased stress or strain being put through the calf and Achilles complex and through there. So we're always going to be looking at optimizing foot intrinsics. And then hopefully this goes without saying if you've listened to any other podcast episodes in the past, but we're always going to look higher up the chain as well. So we're always looking at, their core and pelvic control. We're looking at their hip functioning. We're looking at their strength of holding their turnout, all of those types of things to make sure we're optimizing all of that as much as possible to offload the calf and Achilles complex as much as we can. In some dancers, that stuff is going to make a massive difference. And in other dancers, it may already be functioning quite optimally. And so it may have less of an impact, but we always need to address what is happening higher up the chain to make sure that we're not missing any of the things that are causing that overload in the calf Achilles area to begin with. In terms of other kind of adjunct things that we can use, especially in physio, some people respond well to certain modalities that may be available. So things like ultrasound or shock wave or red light or those types of modalities. So that is always an option to try those through physical therapy and see if any of those make a difference in terms of reducing some of that inflammation and decreasing some of the pain. Taping is something that we will commonly use to try and offload that area a little bit. There's lots of different types of taping jobs we do. Some that are utilizing more like elastic type taping, like KT tape, and some that are more like rigid strapping just to try and offload. But regardless of what taping technique you're doing, the idea behind it or the goal with it will be to try and offload that growth plate. So where it's inflamed, we want to try and offload that as much as possible. I will say, so I do use taping. I don't want to say quite a bit, but like definitely use it in my practice. But I will say with this particular condition, I don't find it as effective as I do with some other things. Like actually even for like an Achilles tendinopathy, taping is maybe more supportive or more helpful than in the case of Sever's. One thing that actually often makes a bigger difference is using a little bit of a heel lift or like a gel heel cup. And so the idea behind this is it's something you can put in your shoes and potentially your dance shoes, depending on what style shoe you're wearing, that just raises the heel just a tiny bit. The gel ones are really helpful because they provide a little bit of like cushioning in through there as well. But if the heel's raised a little bit, that takes some of the tension off of the Achilles as well. And so where it is attaching into that calcaneus, that's going to slacken it a little bit and take some of that tension off of it. So I actually tend to recommend and trial using some sort of a heel lift and usually like a gel cup to start with, probably before or even instead of trying taping, just because I've had better success with it in terms of offloading that. That being said, it's a temporary measure. Eventually we need to be able to have like heels flat on the ground, especially if you're dancing in bare feet or genres that have shoes that don't have any sort of like a lift in them. And so in those cases, sometimes we then will use taping to still try and provide some offloading and some support. So that's not to say that one is necessarily better than the other, just maybe one, I find the heel lift a little bit more beneficial in like the acute phase where it's really inflamed still, versus maybe when it's a little bit calmed down and it's more like getting back into return to dance activities and things like that, then maybe taping might be more supportive. We're always going to be looking at and addressing footwear, and especially footwear that is being worn outside of the studio. So again, we ideally want footwear that is going to be fairly supportive, potentially be able to accommodate one of those little like heel lifts or a gel heel cup or that type of thing. But sometimes we also have to be a bit creative with footwear because depending on how tender it is, some people don't tolerate rubbing from the back of their shoes super well. So sometimes I've had dancers, and not many, but there's two that pop into my mind that I'm thinking of, who, like, for a period of time, it was inflamed enough and tender enough that they couldn't tolerate shoes rubbing on the back. And so in those cases, we were like looking at more kind of slip-in style footwear, which is not necessarily my recommendations, like long term, again, just in terms of like thinking about foot functioning and things like that. But in some cases, just to eliminate any irritation through the back, that is necessary. And so we're looking at footwear outside the studio, like what are you wearing to school? What are you wearing, for other just parts of daily life, but then also potentially looking at footwear in the studio. So I have had dancers who we will actually bring them back into the studio when we're returning to dance or as part of their activity modification, and actually try and have a more cushioned or a little bit more supportive shoe in the studio so that they can accommodate some sort of a heel lift or just have a bit of offloading of that area. So certainly looking at footwear and what it is that they are utilizing. And then depending on the dancer and sort of their presentation and what their foot structure is like and things like that, we may or may not actually be exploring orthotics as an option as well. I will say this is not something that orthotics are my initial go-to, unless there's other things as well from like a structural perspective where I'm like, okay, yeah, maybe they need that extra support more long-term. Like I said, more often than not, I have dancers who do really, really well with that gel heel cup temporarily for a short period of time. And then they don't need any additional support beyond that. So if we think this dancer may need additional support beyond that, then orthotics are certainly something we might look at. But again, we can only use those in our street shoes. And so we need to make sure that we're looking at the mechanics of the foot and the foot intrinsics and optimizing all of that function as much as we can so that when they're not in their street shoes, they also are able to function really well and really efficiently and not have this be an issue. All right. Those are the main things I wanted to say about treatment. I'm going to just wrap up by saying, and I think I said this on the podcast on Osgood Schlatter as well, although I don't know if I did, and I should have, but I just wanted to finish off by saying that this is what we term a self-limiting condition in the sense that it is inflammation of the growth plate, and our growth plates are not active and open forever. Our growth plates eventually ossify and become sort of solid bone, for lack of a better description. And these issues will resolve when that happens. And so when they are no longer metabolically active, they generally become sort of a quote unquote non-issue. So that is sometimes really comforting for dancers to know that this isn't a problem that they're going to have to deal with for forever and ever and ever and ever, but it is a problem that they may need to manage for the duration of while they are growing. And so this can be something where, it becomes symptomatic, they have to manage it for a bit, they might have to modify some of their dancing, and then it settles down and they're doing really well for say 6 months, but then it might start to creep back again. And so then maybe we have to go back to some of the old management strategies. And so this is a condition that may need management or managing while they are growing, but when they finish growing, it will no longer be an issue. That being said, all of the things we talked about in terms of treatment or rehabilitation of this are really important, because if we completely ignore the condition, knowing, it's going to go away when they stop growing, and don't sort of work on some of those rehab principles, we do sometimes see other compensations that crop up as a result, and those may not resolve when you finish growing. And so those can be things with the calf or the Achilles itself, but more often than not, it's other things that become a problem because dancers have sort of changed the way they're moving a little bit, or changed the way they're sort of subconsciously protecting that area. So although the condition is self-limiting, and so it is not going to be a problem forever, it is important that we address it while it is an issue to limit some of those longer term potential consequences as a result of compensation. So that is what I want to say about that. If you have any questions, please feel free to reach out to me. My email is in the show notes, or you can reach me on social media at dancephysioerica. Erica is with a K. And once again, thank you so much for listening, and I hope you have a great rest of your day.